Okay, everybody. So thank you so much for taking time out of your busy day to join me. I just want to start with a little bit of a disclaimer because I think this webinar was more advertised on how to search for information, but we're really going to focus on how to evaluate information. So my apologies because it looked like the little bit of the original intro. We know we had a conversation. We know we had a conversation about this. We know we had a conversation about this, and it sort of I think it changed. But hopefully, you will still find some information. You'll find this worthwhile. All right, so let me just see about advancing. Okay, so just bear with me for a moment. I'm just going to minimize the participant views because it's cutting off my slides. Okay, perfect. So this is just a quick agenda that we will have today, and it is indeed going to be a bit of a whirlwind tour, but we're going to talk a little bit about the types of health information on the web and some of the current practices that the Canadians when they are searching for health information. And then we're going to use an evaluation criteria that is my favorite. It's called the C.R.A.P.P test or the C.R.A.P.P test. And it walks you through a series of steps on how to think critically about not just health information, but any information that you find online. And then we will have a really quick sample search topic. So we can do this sort of evaluate a website using this criteria, the C.R.A.P.P test. And then we will have some time for wrap up and questions. So as we know, there's a lot of information on the internet, and there's a lot of health information on the internet. And although this is an older citation, I do like it because it is specific to Canada. So it's very common for home internet users to use the internet to look up health information. It's a wide range of topics that we look up. So we might be looking up information on lifestyle changes, like increasing exercise, eating healthy. We might look up a symptom we have, like a headache and muscle aches, and try to do some self-diagnosis. If we're recently prescribed a new medication, we might look up that medication to learn a little bit more about side effects. And also we look up information on alternative therapies such as acupuncture. Increasingly, the internet is becoming our first stop for looking up health information. In the past, we were more likely to ask our family doctor or maybe ask a friend or a family member. But increasingly, the internet is becoming our first stop when we have a health-related question. And there's lots of types of different health information. I'm just going to go into some select types, but there are hospitals have websites such as the University Health Network. CAMH has its own website. Governmental agencies have health websites where you can get health information like Health Canada or Public Health Ontario. There are numerous consumer health related websites such as Diabetes Canada. Organizations will have their own health websites such as the Canadian Centre on Substance Abuse, and people may also host their own personal health website. Journals such as the Canadian Medical Association Journal are available online, so that could be considered a health website. And there are various books available online, and these could be for clinicians such as nurses, or they could also be self-help books for the general population. Additionally, there are even more types of online health information, such as blogs, and those could be an organizational blog, such as from the National Institute of Health Research in the US, or it could be your own personal blog that you just host on a WordPress site. Social media can also be a source of online health information. For example, Twitter, and then news organizations post and share health information, such as the CBC and also the Toronto Star. So searching is really easy. And the great thing about searching for health information online, it can really empower you with helping you make a decision. It also gives an opportunity for people to share their experiences. You also are afforded a bit of privacy because you may not have to ask a person a question. You can do a bit of searching on your own before you ask a question, and it's great for for answering quick questions. Say if you forgot to ask a pharmacist an information about a side effect when you went to go pick up a new medication. The searching is easy, but sometimes finding answers is not so easy. The reason is that the information on the web, as we all know, it's not regulated. So unlike a new drug in Canada, that has to go through a strict approval process through Health Canada. But you can put any type of information up on the web. A- As a result, what may happen is that often there may be information that suggests an unproven treatment might be the perfect solution for an issue. More increasingly, what I find is that the information online isn't complete. It's only giving you part of the answer. And then also, there can be quite a bit of conflicting advice. One website might recommend one type of approach, where another may say, no, this works better. So while searching for information is easy, finding the answers is not. So what that means is that you can search and you can find, but what you really also have to do is evaluate the information. And I really like this because I like this cartoon because it really explains, like, you don't particularly know where that information is coming from unless you take some really detailed, devoted steps to evaluate it. So this is where my favorite handy dandy evaluation test comes in, the C.R.A.P. test, or the C.R.A.P.P. test. So the C.R.A.P.P. test was created by librarians from the California State University, and it's been around since the early 2000s. And what it stands for is currency, relevance or relevancy, authority, accuracy, and purpose. And we will go through each of these individually. But it really prompts you to ask questions about the source. And the motivation to do so is that there is a lot of information available, a wide range from a numerous sources. But the question is, have you actually found good information, value information? And it is essential to think critically before deciding. And this just isn't for health information. This is actually for any type of information. So just a personal anecdote for me is that I recently have become a new dog owner, and I've realized there's lots of information out there. Take your dog to a dog park. Don't take your dog to a dog park. Give your dog this type of bone. Don't give your dog this type of bone. So everything I'm looking at, I am actually kind of applying the C.R.A.P.P. test myself to help me decide, should I actually, how much weight should I give this? How much weight should I give this information that I have found? So firstly, we will start with C, the currency of the information. So this is mostly about how old the information is. And you can look at this using a variety of methods. One is that you can look at when the date the information was posted. So when Finding information online, there should be a note that this information was last posted and updated at such and such a date. The other thing, especially with health information, it doesn't necessarily mean just when the information was posted online. It also means if they are citing any medical studies to support the information online, how old or how recent were those medical studies? Because as we know, medical information can change. And one example of this is the current global pandemic of COVID-19. What we know about COVID-19 now is very different from what we knew a year ago. So that's one example of how you really want to look at how current the information it is and how recent it is. The other thing is relevancy. Now, I like to think of relevancy as when I look for information, I always like to think about it is that it's only one source is only one part of the puzzle of the big picture that I'm looking for. So the question is have you consulted numerous sources? Because looking at more than one source is always better because then you're getting that diversity of information you are looking for. Another question is it really answering your question? Is it match the topic that you're looking for? And who is the information written for? And is the language clear and straightforward? Another thing they also mention is if there are any typos in the language too. That's another way you can evaluate the relevancy. Next, which is really important, is the authority. Now, the authority often where you can really find information about the authority of the information is when you're on a website, there should be a section that says About Us. And it's great to click on that because it should provide information on who is the author, the publisher, or the commercial sponsor of the information. So who's producing it? The other thing you can look at is if the URL reveals anything. So is it a .com, which would likely indicate a commercial source, or is it a .gov, which could be would be a source from the US governmental information. Another example would be .ca, which would indicate that the information is coming from Canada. When any information is listed online, hopefully the credentials of the writer or the organization will be provided, and there will be information on their experience with the topic, and hopefully there will be information on the contact information for the producer. So an email address, either their geographical location. And so, as I mentioned earlier, this should be provided under the About Us on the website. Next is our second A, the accuracy and And this is reliable and the truthfulness of the information. When you're looking at health information online, where does it come from? For example, is this information that's being posted that has been supported by past medical research? Uh, what's the tone of the language? Are they conveying facts, or is it mostly opinion, or is it conveying a lot of emotion? And then you can tell this by if there are references supporting any claims for the information. Next is your P, your purpose of the information. So what is the purpose of the information? Why is it existing there up on the web? And there can be many different purposes. For example, it could be to teach the reader about something, or it could be selling a cure. It could be to entertain. or it could be posting information to raise issues for a cause. And then again, are there any personal biases, political biases, or ideological biases for the purpose? And this is again where you're looking for the purpose, you're looking when you're reading it to see if it is an objective point of view or is it overly opinionated. And it's also to look at, is the intention of posting the information clear, or is it a little bit buried on the website? So it's not overly obvious. So now we're going to actually look at some evaluation, hopefully in action. So what we're going to look at is the ketogenic diet and mental health. That's going to be our sample topic today. So the ketogenic diet, it's not new. It was first I wouldn't say discovered, it was first used in medical practice in 1921 by a Dr. Russell Wilder. And it was used to treat epilepsy before anti-seizure medications were available. And the diet is one where you eat high fat, uh, moderate amount of protein, and just very, very low carbohydrates. To this Currently, where the diet regime has evidence and proven to be effective is for rapid weight loss. However, the medical literature does note that there are adverse effects with this diet. It's not necessarily without any adverse effects, and long-term effects can include kidney stones and mineral deficiencies. However, the ketogenic diet has really increased in popularity over the years and now is being touted as a little bit of a cure-all for conditions that aren't rapid weight loss and aren't for controlling epilepsy in epilepsy prior to when anti-seizure medications were widely available. So if we do a search, and I'm using Google because pretty much everybody uses Google, so I'm not using Bing or anything else because pretty much that's the search engine of choice these days. What we do when we do a search is that often you will see in Google, you will see this search snippet. And my advice is to avoid the search snippet because it doesn't give you really a complete a complete picture of all of the information available. It's just kind of giving you this, basically I like to think about it as a quote. So we're going to ignore that search snippet for today's exercise for applying the C.R.A.P.P test. And instead, here are our top 3 results. And what we're going to do is we're going to focus on our top result when I did this search from the Diet Doctor. Now, just a quick note about the ordering of your search results. This will always change. So if you do this same search tomorrow, you are probably going to get different results, or you may get different results than what I received today, last week when I was putting this presentation together. But let's just look at our top hit. So the Diet Doctor, so as you can see, there we go. They're saying ketogenic diet for mental health, come for the weight loss, stay for the benefits, mental health benefits. Now, I know this screenshot's going to be a little bit hard to read, so I'll just give a recap of what's on this page, and then we'll go into more detail into specific content on the page. But essentially, they're talking about the ketogenic diet for mental health, but they're not talking about mental health as in having a low mood. Instead, they're talking about the evidence of the ketogenic diet for treating specific mental health conditions, such as schizophrenia or anxiety symptoms or depression, and they've kind of lumped it all into this big bunch on this web page. And I did a word count, and it's over 500 words. So there is a lot of information on this web page. And then when you go in, the information is a bit all over the map. It lumps together medical research. It lumps together people's personal stories. So it's a really good example of applying an evaluation criteria, the C.R.A.P.P test, to how they're representing the evidence for the ketogenic diet and mental health on this specific website. So let's start with our C, the currency. If you look at the headline, it says indeed that this was updated in 2022. So that's easy. To find. So they're saying that this is current information. However, if you scroll down to a lot of the evidence of the medical studies that they are citing, they are not current. Information from citing a study from 1965 as evidence means that they're giving information that's almost 50 years old. And one example on how much medical information can change is the current COVID-19 pandemic. So what you're looking for when you go to a website that is citing a medical study as evidence of something working, you really have to look at how old that evidence is. The other thing is that they are also giving a lot of really incomplete information for our relevancy. So they're saying that they've received a number of testimonials, but we don't know who Asa, Sharon, and Allison are. We don't know if they're doing this diet in conjunction with taking medication or engaging in talk therapy. Maybe they're also exercising more. The other thing is we don't know how long they've been doing this diet. And we also don't know if they are doing this diet with working with a dietitian, because it's one thing to read about information online and try to do it on your own. It's another thing to be working with someone who knows exactly how a diet would work. So exactly what does it mean that you are eating a moderate amount of protein? So this is not really the relevancy is it really answering our question, because it's not really addressing things very clearly. Next, we are going into our authority. Who is the producer of the information? And remember with the authority information, we really want to know about the credentials. Are they qualified? Why are they, where are they from? And so when you click on the About Diet Doctor of the website, they do indeed provide, so they do try to provide information. But if you look at their mission is that they are not a mental health organization. They are not a dietitian's organization. Their goal is to make low carb and keto simple. So essentially, their goal is to promote one type of solution. They're not promoting healthy eating. They're promoting low carb and keto eating. Now, if you go further down, and sorry, I just could do a quick screenshot, but they have been around since 2001, and they are outside of Sweden. And so while they say their guides are written by medical doctors and experts and based on scientific evidence and practicing physicians, in our next slide, we'll just see a little bit how what they are representing as trustworthiness is a little bit questionable. So next thing, if we actually look at the authority, and as mentioned previously, to tell the authority, you can look at the domain ending in a website. So .com generally equals commercial. So this is not a governmental website. This is most likely a commercial website. Then also authority stands for who wrote it. Now, this is not written by a dietitian. So this is not written by a dietitian who knows about how to effectively design a ketogenic diet for someone who wants to try it. This is written by, if you click on it, this is written by a journalist, which is nothing wrong with that. They are disclosing who wrote it. And then they're saying that it was reviewed, so someone else did read it to hopefully ensure more accuracy. And then we'll talk a little bit later about the little green that says it's evidence-based. But again, this was written not by a dietitian. So now we are going on to, sorry, the little thing is just cutting off. So now we are going to our accuracy. Now, the thing is that when you read this information is that it's a big mix of someone's own personal experience and also the medical studies that they are quoting as evidence. And as you see, what's happening is that they're really kind of highlighting information where they say the ketogenic diet is really a cure-all. But then the interesting thing about this website is that if you actually hover your cursor over the numbered references, then they say that there's actually a lot of the evidence, what they're saying their evidence for is actually very weak evidence. So what weak evidence would mean is that it is not, they're not pulling from a large pool of information. So what's my own experience is not necessarily true of the experience of people in a wider population. So if we go in again, and then the other thing is that the other kind of confusing thing I find about how they are sharing information, and again, here's this really old citation that they're quoting from World War II. And it's also from, so it's quoting information from World War II in a study published from 1966. The other thing is that on this website, they've also lumped in all of these different types of medical studies touting information that the ketogenic diet can work for mental health and a variety of mental health conditions without actually discussing what all of these different medical studies mean. Because there are a lot of different types of medical studies. And what they're doing on this website is that they're just lumping them all together in one big bunch, and they're not saying what type of studies they are. So while they're saying they're giving evidence, they're just lumping personal stories together, they're lumping different types of medical studies together, and they're really not giving the readers a guide on what all these different types of information mean to give you the big picture together, what the ketogenic diet for mental health. Next is the accuracy. Can you verify information? Now, the only thing is when you read the information on this website, they give this as the cure-all, and they're saying try this, and there's only one really small section where they say, where it's one person who contacted them and said that this diet didn't work for me, it made my anxiety worse, and he believes he believed that it caused panic attacks. So that just shows that the majority of information that was being shared is overly positive, but they don't really say how the limitations, and they don't really mention how this is all just someone's personal experience, and person's personal experience is not going to be another person's personal experience. It's really being kind of touted as going to be great for everyone. There's just that one little section there. So now we're going to go back to the evidence. Now we're going to go back to the evidence-based. And what does this mean? So they're saying that this guide is evidence-based. And the challenge with this is that anyone can put a tag up that says it's evidence-based. But what that actually means is that you're translating research findings, not just one research findings, but a wide range of research findings into a daily care or daily practice to help people make decisions. So evidence-based is not one person's personal experience, while that is indeed can be validating. Evidence-based means you're taking the research available from a wide range of medical sources, medical studies, and you are taking the findings of all of those together and saying what is the most conclusive. So just because something is labeled as evidence-based does not necessarily mean that it is going to be evidence-based. And as you can see, the information that is being shared is not
Oh, Sarah, I think you muted yourself.
sorry about that. Thank you. Okay, so as we can see, the information that is being shared is not objective. It is not fact. It is more so opinion. So lastly, let's just go. Lastly, purpose. So to look at the purpose of the website, as you can see, if we click on this, this is offering a free trial. And really, the purpose of the website, even though this information is available for free, the purpose of the website is to sign up. It's $100. You get 30 days free, but it's $100 US a year. And the purpose is for you to sign up so you can do a ketogenic diet. And they offer recipes, tracking progress, weight loss programs. But this is not an organization where the intention is to just share information for free. This is an organization that is trying to sell you something. So that is just really a quick overview of how you can apply the C.R.A.P.P test to this website, Diet Doctor. And as you can see, our takeaways are the ketogenic diet. It was really promoted as a cure-all. There was only one little quote from one person saying, I had a negative experience using this diet. Uh, the, the research that they cited was all much older research. It was labeled as evidence-based, but it really wasn't. I mean, I don't really think sharing a study from World War II, published in 1965, is really providing the best evidence. Personal stories are valuable, but personal stories is a very different than a medical study. There was a lot of a blending of opinion. In fact, both opinion from individuals who tried it, and then that one clinician who said, oh, this is great. I find this works amazing. And while there were sources cited, uh, if you go in and you look at the references, it's a big mix of animal only studies, but then some study, which, what a ketogenic diet for hamster is going to be very different than a ketogenic diet for a human. And again, as mentioned, a little debate of those pros and cons. So it really was the purpose was really simply to promote this diet to as a cure-all. So again, when looking for information, it's really good to look for the currency, the relevancy, the authority, the accuracy, and really the purpose. So I'm going to suggest some further resources because as I mentioned previously, this really is a big whirlwind tour. But the original creators of the C.R.A.P.P test, they have a great handout in PDF. And I like to use it when I'm just looking for information, just to do a really quick run through to say, okay, is this source really a valuable, worthy source of this information? University of Northern British Columbia, they've got a great website that's all about evaluating consumer health websites with them sharing information. If you really want to do a really deep dive, because we saw all those medical studies referenced, the National Institute of Health Research from the UK, they talk about what are the different types of health research. The National Library of Medicine in the US, they also have a great website on understanding medical research. And lastly, there's a fantastic online tool also from the UK, and that's all how to understand health research. And that's information how to make sense of all of those different medical studies that are available. So that was our whirlwind tour of using the C.R.A.P.P test to evaluate the Diet Doctor website. And now we have time for wrap up and questions. But it's the really important takeaway is that it's important to read any information you find online critically, even if an information, as we saw with Diet Doctor, even though that was our top Google hit, it doesn't necessarily mean that it was a good tip. And the C.R.A.P.P is an easy first step, and it's easy to remember when you read health information online or when you read any information online. So questions and thank you.